Okay, here we have a look at the close-up of the bone tissue. Here you can see the cortical bone very nicely, and then the spongy bone with all the little trabeculae on the left. The cortical bone we're going to discuss most here. You can see the blood vessels that actually pierce and go into the bone. They come along with the periosteum along the surface of the bone and then enter the bone at specific points. The blood vessels that are running up and down vertically are called Herversian canals, and they are surrounded by circular lamina that just kind of go around them like the rings on a tree. And those units of one blood vessel with all the lamina around it is called an osteon. Many, many osteons together create the dense cortical bone that creates the strength around the surface of our bones. You can look in the close-up circle here and see how the cells actually fit into the picture. Here you have a Herversian blood vessel surrounded by its lamina, and then these little dark spaces. That's where the mature osteocytes live, and we call them lacuna, those spaces. The lacuna are all connected to the blood vessel by tiny little caniculi, and that's where nutrients can diffuse out from the blood to the cells, and where waste products from the cells diffuse and go back to the blood vessels. Here's a micrograph showing some of the same things. In the center you can see that kind of lighter circle, that's where the blood vessel was, and then those dark spots are the lacuna out toward the surface, and you can see the little caniculi going out to the lacuna in a single osteon here. This bone is very dehydrated, obviously, but that kind of gives you an idea of what the tissue is like. Now we can compare the bone tissue that you just saw in the last slide to what cartilage looks like. Cartilage, as you can see here, has no blood supply and no nerves. You can just see that there's this kind of protein cartilaginous matrix, which is sort of like plastic almost, and then you have these cells, the little lacuna for the chondrocytes. Chondrocytes are the cells that make up the cartilage, and you can see how they look here. Okay? The way they get their nutrition is through diffusion. So their matrix is slightly more liquidy, of course, than the more gel-like than the bone matrix, and so nutrients can diffuse through their matrix a lot easier than they can through the bone matrix. And that's how they get their nutrition, rather than through direct blood supply. Here we can see how bones develop. First of all, on the left in the upper row, you can see the first cartilaginous model that will be developed in the fetus. This starts to appear, I think it's within 4 to 8 weeks of the embryo's development. And then as we move on, you can see that the cartilage, which has no blood supply, is reached by a blood vessel. The blood vessel brings in oxygenated tissue, and this pink area is what we call the ossification zone. Where the blood vessel has arrived, there's enough oxygen for osteocytes to migrate in. And here you can see osteocytes have migrated in and they've started to ossify. In the orange, that's what the orange represents there in the third diagram. They've started to ossify the bone. And you can see the ossification is moving out and out toward the ends. Next, we have what we call a secondary ossification center. The first blood vessel to come was started a primary ossification center, and the second one to come, as you can see here on the end, on the bottom row, is the secondary ossification center. So blood vessels enter both ends of the bone and start 2 secondary ossification centers as well. Then the secondary and the primary ossification centers start to grow out towards each other, and the middle model on the bottom row is really what the bones look like during childhood. And here they're growing closer and closer together, but we still have some cartilaginous zone here where the bone can grow in length. So we have new cartilage being laid down and then ossification centers growing into that new cartilage. And then the last diagram shows a mature adult bone where you have nothing left but an epiphyseal line where the growth plate was. So just to recap, the first row shows fetal development, and then the last part starts with the bones, with what they would look like at birth, during childhood, and then finally during adulthood. So here you can see what the baby's skeleton looks like as a newborn. There's actually 350 bones here because they haven't fused together, the ends of the bones have not fused together. So babies have 350 bones and adults only have 206. So most of those bones begin to fuse, and then we only have 206 by the time our skeleton has been completely matured. Here you can see a picture of the skeleton dividing the appendicular and the axial skeletons. Appendicular is shown in this yellowish color, tannish color, and then the axial skeleton in blue. Again, the axial skeleton is sort of like the fishy skeleton, where the very central part, skull and the thoracic cage and the spinal column down to the sacrum, really its function is protection of the internal organs and to create stability for the body, and then the appendicular skeleton is to create movement and to allow for us to do work. This is just the posterior view of the same thing. So the previous slide was the anterior view, now we see the posterior view, or the back side of the skeleton, showing axial and appendicular. Take some time to make sure you know which bones are in which part of the skeleton. Here we're going to look briefly at the individual parts of the skull. What I want you to remember is that there are some paired bones and some single unpaired bones in the skull. And so when we talk about it in class, we'll go through and make tables of the paired and the unpaired bones. But for now, I just want you to kind of look through these pictures and get an idea of where the bones are in position. So for example, the parietal bones, the temporal bones, the zygomatic, and the maxillary bones are all paired, whereas the frontal and the occipital bones there's only one each of those, and the mandible there's only one. So just to kind of get you started thinking in those lines. Here's the anterior view of the skull again, and you can see again the paired bones and the unpaired bones, the frontal just being one, the mandible just being one, but then two maxilla, two zygomatic, two nasal, etc. Okay, so again, have a good look at these pictures, and we'll talk about them a lot more in class. Okay, the spine is what we're going to move on to look at next. There are 4 regions: the cervical, thoracic, lumbar, and sacral regions. There are 7 cervical vertebrae, or individual bones making up the cervical spine. There are 12 thoracic bones. There are 5 lumbar bones, and then there are 5 fused sacral bones. And then there's the coccyx at the end, which is actually 4 little tiny bones that are fused together. What I want you to look at right now are the different curves in the spine. The lumbar spine and the cervical spine are curved in the same direction, with the convex edge toward the anterior of the body. And then the thoracic and the sacral regions are curved oppositely, with a concave surface toward the anterior of the body. The thoracic and the sacral curves are what we call primary curves, and the cervical and the lumbar are what we call secondary curves. And we'll discuss how those develop a little later. Here we can see the anterior view of the spine, again with the cervical region, thoracic region, lumbar, and sacral with the coccyx on the end. There are 7 again cervical vertebrae, there are 12 thoracic, there are 5 lumbar, 5 fused sacral, and 4 fused coccygeal bones. We have a close-up look at a typical vertebra. You can see the spinous process. This is actually the posterior part of the bone, and anterior is the lower part here, the body. The vertebral foramen is the area where the spinal cord runs through. And then we have 2 surfaces facing up towards us called the superior articular processes. Then out to the sides we have the transverse processes. Underneath, which we can't see right now, there are 2 surfaces directly below the superior articular processes, which we call the inferior articular processes. And those superior and arterial processes, they touch so that we have the upper and the lower vertebra connecting at that region as well. And then between the bodies we have large cartilaginous discs we call intervertebral discs that help to give the spine its flexibility. So we'll look at that a lot more in class as well. But I want you to be familiar with these parts: the transverse processes, the spinous processes, the bodies, and the vertebral foramens. Here you can see a lateral view of the vertebra. This is a lumbar vertebra, and I can tell that because the spinous process looks so blunt. Here you can see very well the superior articular process and the inferior articular process as well. The transverse process is sticking out toward us, and you can see the body. Then between the inferior articular process and the body, you can see a little notch there. That is the intervertebral foramen, and that's where the spinal nerves are going to be exiting. So we'll talk about that again more in class too, but familiarize yourself again with the different parts of the vertebra in the picture. Here we'll go back to talking about the curvatures. This baby illustrates the primary curvature, one big C-shaped curve of his whole entire spine here. When the baby is about 3 to 4 months old, he'll start raising his head up, and that's going to create an opposite curvature in the cervical spine. And then at a year of age, when he starts to walk, he's going to create an opposite curvature in the lumbar spine. And those two curvatures, the cervical and the lumbar, are then called the secondary curvatures. Now to move on down to the rib cage, here we're going to talk about the ribs a little more specifically. There are 12 of them, and we divide them into the true ribs, the false ribs, and the floating ribs. So the first 7 are true ribs. As you can see, they start from the spinal column in the back, they come all the way around, and they have their own individual little cartilage here that connects them to the sternum and the manubrium in the front. Then the false ribs, 8, 9, 10, okay, those are all what we call false ribs because they come around to the front, but they all connect in with one cartilage, right in with the 7th cartilage, and connect to the manubrium here in the front that way. They don't have their own individual cartilage. The last two, 11 and 12, are completely floating. They have no cartilage and no connection to the front, so they're only connected to the spinal column in the back. So again, 7 true ribs, 3 false ribs, and then 11 and 12 floating ribs. And just take note of the other parts of the bones here, the clavicle, the manubrium, sternum, and the xiphoid process. Costal, a term I want you to be familiar with, means the ribs. Okay? So anything that you hear where it says costal cartilages or something like that, it's usually referring to the ribs. Now we're going to go through and just look at some pictures of the appendicular skeleton as well. Here you can see the upper limb with the humerus, the radius, and the ulna, and the elbow joint shown in the picture here as well. And here you can see the hand. I'm just going to briefly talk about the different names of the joints. Between the wrist bones of the radius and the ulna and the carpal bones, okay, you have the radiocarpal joint, and then you have between the carpal bones, the proximal and the distal rows, you have the intercarpal joints. Then between the distal row of the carpal bones and the metacarpals, you have what we call the carpal metacarpal joint, or the CMC joint. Then you have the metacarpals here articulating with the phalanges, and we call that the metacarpal phalangeal joints, and we abbreviate that MCP joints. And then between the phalanges, we have a proximal and a distal joint. And so the proximal joint, or the proximal interphalangeal joint, we call the PIP joint, PIP. And then the distal interphalangeal joint we call the DIP, or the dip joints. So you have PIP and dip joints, and in the thumb, of course, you just have one interphalangeal joint, so we just call that the IP joint. Moving on to the lower extremity, here you have the femur, the tibia, and the fibula, and we've talked about those extensively in class. And here's the knee joint shown anteriorly and posteriorly. And now looking at the foot, here we have the 7 tarsal bones, the talus, calcaneus, the navicular, the cuboid, and the 3 cuneiforms. Then we have the 5 metatarsal bones from medial to lateral, 1 through 5, and then we have the phalanges. And the joints are named just identical to the way the hand is. So we won't go into too much detail on that right now. We'll talk about it more in class.